Are you worried about on-your-eye breathing issues? Today we will discuss on it and try to answer on related questions like, is my baby breathing okay? Let's discuss the 7 signs you can't ignore that moment. You're watching your perfect, sleeping newborn, and suddenly, they stop breathing for a second, or they make a weird little whistle. Your heart just plummets, and you have that one terrifying thought, are they okay? If that's you, I promise you're not alone. That fear is real, and it's something so many new parents go through. Learning your baby's own unique language of sighs, snorts, and rhythms is one of the toughest parts of the job. But I want to help you sort through the noise. We're going to walk through the completely normal, sometimes quirky breathing patterns that almost all newborns have. Then, we'll get very clear on the 7 critical signs that mean it's time to call the doctor. By the end of this, you'll feel more confident knowing when to worry, and when you can take a deep breath yourself. Alright, before we get to the red flags, let's get comfortable with what's perfectly normal. A newborn's breathing is nothing like ours. It's often irregular and surprisingly noisy, which can be unsettling, but most of it is just their brand new respiratory system figuring things out. First, let's talk speed. Newborns breathe fast, way faster than we do. A healthy baby can take anywhere from 40 to 60 breaths a minute when they're awake. When they're sleeping, that rate can slow right down to 30 or 40 breaths a minute, and sometimes even as low as 20. For comparison, we adults poke along at about 12 to 20 breaths per minute. So what looks like hyperspeed to you is actually your baby's normal, healthy pace. Next up is the rhythm. This is the one that freaks parents out the most. It's called periodic breathing. This is where your baby will breathe for a bit, then take a short pause, usually less than 10 seconds, and then start right back up again. It's super common, especially during sleep, and as long as the pause is brief and your baby isn't changing color or seeming distressed, it's nothing to worry about. You'll also notice that newborns are belly breathers. Their little tummies will rise and fall dramatically because they use their diaphragm muscle more than their chest. This is totally normal and actually pretty cute to watch. And finally, the noises. Oh, the symphony of gurgles, whistles, snorts, and little grunts. Their nasal passages are teeny tiny, so even a little bit of mucus or spit up can make them sound like a whole barnyard. Most of these sounds are harmless. Even the occasional sneeze is just their clever way of clearing things out. So, to quickly recap, the things that are usually okay are fast breathing, short pauses under 10 seconds, dramatic belly breathing, and a whole collection of gurgles and whistles. Okay, now that you have a picture of what's normal, let's get into the signs that mean you need to pay closer attention. These are the red flags that tell you it's time to act. Sign number 1. Persistent rapid breathing. We said 40 to 60 breaths per minute is the normal range, but the key word here is persistent. If your baby is consistently taking more than 60 breaths per minute while they're calm and resting, that's a warning sign. Sure, they'll breathe faster when they're crying, eating, or worked up, but it should slow down when they settle. If you count for a full minute while they're calm, and the number is still over 60, it means they're working too hard. Time to call the pediatrician. Sign number 2. Nasal flaring. This is a really clear visual cue. Look at your baby's nose. If their nostrils flare out wide with every single breath, it's a sign they're struggling to pull in enough air. It's their body's automatic way of trying to open up the airways to get more oxygen. For a baby who breathes almost exclusively through their nose, this is a significant sign of distress. Sign number 3. Retractions. Retractions are when you see the skin sucking in with each breath. You'll notice it pulling in between their ribs, under the rib cage, or in that little hollow at the base of their neck, just above the collarbone. This is a telltale sign that their main breathing muscles aren't enough, and they're recruiting extra muscles in their chest and neck to do the work. It can look like their whole chest is sinking in, and it's a definite reason to seek medical help. Sign number 4. Grunting or other worrisome noises. We have to distinguish between normal baby grunts and distressed grunts. This isn't the cute little sound they make when they're pooping. This is a consistent, sharp, low-pitched grunt you hear every time they breathe out. A baby does this to try and keep air in their lungs and stop their tiny air sacs from collapsing. It's a serious sign. Other concerning sounds are wheezing, a high-pitched whistle when they breathe out, or stridor, which is a high-pitched, strained, squeaking sound when they breathe in. Any of these, grunting, wheezing, or stridor, warrant a call to your doctor. Sign number 5. Changes in skin color, cyanosis. This one is a true emergency. If your baby's skin, particularly around the mouth, on the tongue, or on their lips, takes on a bluish or grayish tint, it's called cyanosis. It means they aren't getting enough oxygen into their blood. For babies with darker skin, this color change might be easier to see on their gums, lips, and around their eyes. While blue hands and feet can be normal for a brand new baby, blueness around the face and torso is a critical sign. Sign number 6. Apnea, pauses in breathing. Remember the normal, short pauses of periodic breathing? This is different. We're talking about a pause in breathing that lasts longer than 20 seconds. This is called apnea. If your baby stops breathing for that long, or if the pause is shorter but they go limp or change color, it is an emergency. Sign number 7. Lethargy or poor feeding. Finally, look at their overall behavior. A baby who is working this hard to breathe has no energy left for anything else. Are they suddenly impossible to wake up? Do they seem limp or floppy? Have they completely lost interest in eating? Breathing always wins out over eating, so a baby who is struggling for air will often refuse the breast or bottle. This combination of labored breathing and being too tired to eat or act normally is a major red flag. What to do if you see these signs? If you see any of these 7 signs: persistent rapid breathing, nasal flaring, retractions, grunting, a blue or gray color, breathing pauses longer than 20 seconds, or a baby who is lethargic and won't eat, you need to act. Your first step is to call your pediatrician immediately. They'll tell you whether to come into the office or head to the emergency room. If the signs are severe, like your baby is turning blue, has stopped breathing, or is unresponsive, call 911 or your local emergency services right away. Pro tip: if you're worried, try to take a short video of your baby's breathing with your phone. It can be incredibly helpful to show the doctor exactly what you're seeing, especially if the symptoms come and go. Being a new parent is an amazing journey, but it comes with a healthy side of worry. Learning to tell the difference between a quirky newborn gurgle and a concerning grunt is a skill that will bring you so much peace of mind. Remember what's normal: fast breathing, belly breathing, and those little pauses. And keep the 7 warning signs filed away in your brain: persistent rapid breathing, flaring nostrils, retractions, grunting, blue skin, long pauses, and lethargy. Most importantly, trust your gut. You know your baby better than anyone on this planet. If something feels off to you, it is always the right decision to get it checked out. You are your baby's greatest advocate. If this video helped you feel a little more prepared, please give it a thumbs up and subscribe for more reassuring, no-nonsense advice for your parenting journey. Go ahead and share this with any new or expecting parents in your life. It might be exactly what they need to hear. And please drop a comment below. Sharing our own experiences and questions helps everyone feel a little less alone in this.